Anyone who has lived through a severe, throbbing toothache knows exactly how it feels. It is an intense, inescapable pressure that dictates your entire day and keeps you staring at the ceiling all night. When that level of agony sets in, human instinct takes over. The immediate, desperate urge is to simply pull the problem tooth out to make the pain stop. Every tooth serves as a vital, load-bearing pillar for your jaw. The root extends deep into the dense grit of the bone, providing the constant stimulation required to keep that tissue healthy and strong. Extracting that pillar creates an immediate mechanical void. Without a root to anchor and stimulate the site, the jawbone actively begins to shrink. It resorbs into the body, degrading the very foundation of your mouth. As the foundation recedes, adjacent teeth lose their lateral support. They gradually drift and tilt into the empty gap, eventually causing the external facial structure to sag and change shape. Pulling a tooth trades a temporary emergency for the irreversible collapse of your facial architecture. There is a specific medical procedure designed to handle this exact crisis, though the name alone tends to make people freeze up: the root canal. Modern root canals function as the definitive cure for tooth agony, designed specifically to neutralize the infection that causes it. To understand the process, we have to look at the true source of the pain: a bundle of soft tissue hidden deep inside your tooth called the dental pulp. When bacteria penetrate the outer layers of the tooth, the inner pulp becomes deeply infected and severely inflamed. It swells up, but because it is trapped inside a hard outer shell, the pressure has nowhere to escape. That internal pressure creates the throbbing sensation. Eliminating this internal biological threat kills the pain instantly, while keeping the jaw's architecture completely intact. The modern endodontic process is precisely controlled. A dentist carefully enters the tooth and extracts only the infected pulp tissue, leaving the healthy outer shell and the original root structure untouched. Once the infection is removed, the hollowed space is thoroughly cleaned and filled with a dense, solid material. This seals the tooth tight to prevent any future bacterial intrusion. Advanced anesthetics and quiet technology make the physical experience feel identical to receiving a routine cavity filling. You remain numb and entirely comfortable throughout the procedure. The immediate result is a total absence of throbbing pain. This strategy preserves your original tooth root, keeping it firmly anchored in the jaw and maintaining your biological foundation. Saving the original tooth provides the essential stability required for long-term aesthetic confidence. Attempting a smile makeover on a dying tooth is like trying to build a mansion on a sinking foundation. The structure will eventually fail. It serves as a structurally sound base for a restorative finish. The dental team can place a beautiful, custom-matched crown over the natural tooth, locking it into place to complete your smile. The patient transforms an infected, painful liability into a perfectly functioning, brilliant aesthetic asset. If you are putting off a dental visit out of fear, remember that you do not have to live with the pain or lose your natural teeth. You simply need the guidance of the gentle, highly skilled team at Vinova Dental. With clinics in Wangaratta and Thurgoona, Vinova Dental utilizes cutting-edge technology and a stress-free philosophy to make your health the priority. Take control of your health. Visit vinovadental.au to book your consultation and move from pain to perfection.